My work is focused on racism as a social determinant of health, and I started with an interest particularly in Indigenous Australia, but working more broadly, looking at what evidence there is worldwide for a relationship between racism and health. What are the pathways between racism and health? And I guess more recently, in the years since I finished my PhD, I've been looking more at anti-racism intervention. So what is anti-racism theory, policy and practice, and how can we actually do something about racism as a determinant of health? That's broadly the work that I've done. And also done some work on kind of racial discourses in public health, and you may not have seen an article I did on something called the thrifty gene hypothesis, and looking at some of these kind of, I guess, what I think of as scientific, they're just misrepresentations of the ideas of kind of racial science, and this idea that there's been this idea in Australia that Indigenous people have a propensity to diabetes, for instance, a genetic propensity, and just looking at those ideas of race and genetics and the intersection and some of the complexities, because it's been a recent, resurgence of interest in that area, race science and all that sort of stuff. Yeah.
My work in the U.S. has focused very broadly on both socioeconomic and racial or ethnic inequalities in health, and had a particular interest in the intersection of the two. And I've focused a lot of my empiric research on maternal and infant health. And so confronting the really unexplained racial disparity in birth outcomes in the U.S. And there are a number of patterns by race and by class that are not explained by the known causes. And I think a lot because of racism in the United States and because of a vacuum in the research, there's an assumption, the sort of the knee-jerk assumption is, it must be genetic.
Yes.
These differences must be genetic. And yet when you look at the patterns and you see that, for example, although as mother's income goes up, as mother's education goes up among both black and white mothers, the relative racial disparity in birth outcomes is much larger among the higher income women. And it's relatively small among the lower income women. It's very difficult to explain that with genes.
Yeah.
Also, although there's been a limited amount of study in this area, the studies that have been done are all very consistent. When they look at black immigrants to the U.S., black immigrants from Africa, Afro-Caribbean black immigrants, their birth outcomes are actually very good. And yet it's the USA-born that have the bad outcomes. So there are things about these patterns that really don't fit the genetic hypothesis very well. And I'm not the first one to raise a question about whether racism-related stress could be a missing piece of the puzzle. But the results of studies looking at that have been very inconsistent. But the measures that have been used have also been very inconsistent, and that's where I get back to your work and the wonderful review that you did of the measures. And my group has felt that that a systematic and rigorous effort is needed to develop measures of the experience of racism, of the full spectrum of experience of racism, that could be used in order to properly study this question. But talk about a distance away from the ultimate goal. You need a study to develop the measures so that you can do a decent study.
And I've seen that recent paper that
you did see that, I wondered.
Put out, looking at focus groups with people, trying to get to grips with the kind of dimensions that you need in that sort of measure. So that's the work that you're continuing to do work on that, trying to develop a measure for kind of birth-related outcomes.
That's our goal, not that that's enough, but we figure that a focused effort needs to be made there. And the focus groups that you mentioned, this was a real eye-opener for us. We ran these focus groups, some with all with African-American women, some with African-American women of low socioeconomic status, and others with women who were not of low socioeconomic status, and just drew them out to talk about their experiences of racism, because we figured that's where you have to start in developing a measure, rather than with the assumptions of the researchers about what's going to capture the experience. And it was just so striking and consistent that, yes, women talked about discrete incidents of being treated unfairly, and that's what existing measures of racism ask about, is did you experience in the last year or in the last X period of time, did you experience being treated unfairly because of your race? And there are variations on that, but that's the basic focus. And that women did talk about incidents, but what they also talked about, and where they seemed more emotional, and I say they seemed more emotional. I wasn't there. There were focus groups with African-American women, and there was an African-American facilitator, African-American note-taker, but from the reading of the transcripts and the discussions with my colleagues, that women talked about never being free of it, of this, a sense of constant vigilance, anticipating when the next incident might occur, and worrying about their children. And that the vicarious experiences, the both anticipation of and the actual reality of the experience, and that that was just a pervasive and chronic experience. And so, if the hypothesis is that it's through pathways involving stress and the physiology of stress that racism could do its damage, there are other pathways as well, and this is a whole area that just hasn't been measured by the studies.
There was a recent article about the costs of kind of covert racism. I can't remember the exact title, but some of that social psychology literature has started to look at anticipatory anxiety and vigilance. And Rodney Clark's has his term with vigilance, heightened vigilance, and he's worked a bit on that. So I think it's a difficult one. That kind of chronic ongoing exposure is something that we really need to come to grips with, isn't it? And how do you capture that well with these survey methods that we end up using all the time?
We have to try. I have to think that it could be possible. We have some ideas now of ways that might be captured.